Let's talk about rotator cuff tears. So, what is a rotator cuff tear? In order to understand that, we need to understand what the rotator cuff is. Rotator cuff is comprised of four tendons, and these tendons help stabilize the shoulder, but they also help with shoulder movement, specifically rotation of the shoulder joint. Now, these tendons can be torn, they can be injured, and you can have a mild small tear that's partial, or you can have a full thickness rupture of the tendon. It could be one tendon or a combination, any combination of the four tendons. Now, we need to treat these things. How do we treat it? Well, let's talk about treatment in the terms of going from the most conservative to the most aggressive forms of treatment. Most conservative would be medications to control inflammation and pain. They could be over-the-counter anti-inflammatories or prescription medications such as steroids or muscle relaxants if there's a strong spasm component to your symptoms. The next level of treatment would be injections. That could be steroid injections to help calm down the inflammation as well as the pain, or regenerative type of injections such as PRP, or otherwise known as platelet-rich plasma, or stem cell therapy. These help regenerate the tissue and have a 80 to 85% chance of healing torn tendons in the rotator cuff. Surgery is always the last resort, especially for tendons that are ruptured, fully torn, full thickness tears. Most rotator cuff injuries are not full thickness tears and can be treated in the most conservative way.